One of the things that stood out to me about the process of applying to Pitt was the active recruitment and engagement of staff and faculty from Pitt. Other graduate universities, it seemed like it was just kind of up to me to make it happen. But Dr. Bryce particularly was very involved in asking if I had any questions, reaching out after meetings, scheduling an individual meeting with, I believe, almost every applicant, and making sure that if I had questions or wanted to connect with a professor, that I could. I knew a professor from Pitt coming into the program before I talked with Dr. Bryce, and I reached out to her, and she was Dr. Beth Hoffman in BCHS, and she was totally willing to have a Zoom call, talk about my interests, talk about what Pitt could do for me. I felt very supported coming into the program. And what's nice about graduate school is that we're all adults and we all have a much more wide variety of experiences than maybe undergrad, and I've never had a problem in a group project, which is not something that I would have been able to say from undergrad. I would happily work with any member of my cohort on a group project, and I've never had a bad experience, which is really interesting. It's not that normal, teeth grinding bad situation that group projects can be. The first semester is really structured to provide you with networking events, mixers, to get to know people. And I think just from the nature of the cohort system, you become really close with your fellow peers and colleagues. Going to classes together, making sure that we study together outside of class time, using the spaces in the building and on campus to collaboratively work on things. The public health legacy that we have here at the University of Pittsburgh between Dr. Jonas Salk and the polio vaccine, Dr. Peter Safar and the invention of CPR, and Freedom House and the development of paramedicine as we know it, is really critical that I don't think a lot of people know or understand. And so we have a long institutional history of being involved in massive, life-changing, country-changing, world-changing innovation in the public health space. And there's great opportunities to do that again here. I don't think anybody comes to public health linearly. So it's a very rare exception when someone comes to public health in a linear fashion. And so what's really helpful is that there isn't an assumption of baseline, right? Everyone's coming from a different background, and the public health program and the curriculum itself is designed really well to bring everyone to the same level. Because like I said, I had a really heavy quantitative background, but I didn't understand policy or policy implementation or how political science really worked. But I have another member of my cohort who's political science major, right? So she was really good in that. I was really good in epidemiology because that was kind of my background. And bringing us all together into this program and establishing that baseline core of classes in the first 2 semesters really helps everyone start from the baseline. Establishing that baseline means that we all walk away with tangible skills and things that we can actually apply. And then we actually do apply them over the summer. And also, the requirement of a practicum is basically one long interview, right? So if you are really interested in a career in the field that you're doing your practicum in, you can treat that as one long interview.